Hi, Miss Bauer. I know we both agreed that it's probably easier to do a YouTube video to explain my ISU and just go through my kit. So this is what I'm gonna do. I'm just gonna go through it the best way I think I can, and I'll just read through it, explain anything that I think needs to be explained, and I can send you all my notes as well. So here I go. This is my kit. I have my bibliography on top, just with all my links and sources, which I'll also send to you. So I'll just set that aside, but if I just open this up, I'll go over my little patient cases towards the end because I feel like it's better to go through everything first. So I have a couple copies of a pamphlet that I made just to explain to people what different types of careers they can have and just pathways to go. So I'm gonna start on this side. So for this page, I just explained like the different universities and their programs. So just a brief little summary. So McMaster's nursing program prepares students to be professional nurses who will practice in a variety of healthcare settings. Now this number here, this little yellow circle, says 85%. That's the recommended average to have to apply to the program. The one in the green bubble is 120, so they are accepting 120 applicants for the program. And the blue circle here is just to explain that they need to take a Casper test to apply to the program. So for the requirements, I just put exactly what they need. So they need a grade 12 English class, a grade 12 biology class, a grade 12 chem class, and then they need one of the following. So they can either take advanced functions, data management, or calculus. They'll accept either or. And on to the next one. So Western, I just said it's located in London, Ontario, and it provides students with the knowledge and skills to be prepared to practice as a registered nurse. So their average is an 80 to 90% that they say is good to apply to their program. Now their program accepts 125 students, and they also require a Casper test. Now, the requirements for each university and colleges are completely different. So this one is they need at least a 65% in each grade 12 English, grade 12 bio, grade 12 chem, and same thing, one of advanced functions, data management, or calculus and vectors. Now, even though it does say the 65% in each class, it's still recommended that you have an 80 to 90 average. On the back here. So last one for universities that I did is Windsor, and it says, Windsor's nursing program provides the students with an abundance of hands-on learning opportunities during clinical placements in hospitals and community settings. So for this one, they accept 120 students, and their average is recommended to be 85, although Windsor does not require you to take a Casper test. So the requirements for this one as well, grade 12 English, grade 12 bio, grade 12 chemistry, and one of advanced functions, data management, or calculus and vectors. Now for the second part here, I went over the bridge programs because I feel that they can be really beneficial to students who prefer more of a hands-on learning, and it's better for them to learn that way. So bridge programs provide students with the option to have a hands-on learning experience by going to college for the first 2 years of the program. Once the 2 years are over, the individual will have their RPN, or registered practical nurse, and they can choose to go forth and continue to become an RN, or a registered nurse, or find a career as a practical nurse. So I did go through to add on some of the bridge programs we have close by, such as Mohawk McMaster program. So it's at Mohawk's campus for the first 2 years, and then you go on to McMaster. So they require that you have grade 12 English, one of the advanced functions, data management or calculus, and grade 12 bio and chemistry. Their average is recommended to be 75%. I don't know if you can see that very well there. 120 applicants, and you must take a Casper test. Same with the university. Fanshawe and Western, so you need at least a 65% in grade 12 English, grade 12 bio, grade 12 chemistry, and one of the advanced functions, data management, or calculus and vectors. Again, they do say that you have a 75 to 80% average. They accept 125 applicants, and they do require you to have a Casper test. For Lambton-Windsor program, they require you to have grade 12 English, grade 12 bio, grade 12 chemistry, and one of the advanced functions, data management, or calculus and vector. So this one, I'll go back. This one is in Sarnia, and that one's in London as well. And again, just like Windsor, since it's linked there, it doesn't require you to have a Casper test. So that's my little pamphlet there, just to help people to see what's around them so they don't have to go close by, or far away, I guess. So I have standard precautions, how to safely don, use, and remove PPE, PPE equipment, and 10 common medicines in the healthcare setting. So I'll just go through again and read them out and try to explain anything that I haven't written down or feel like I need to. So I'm going to start with the smallest one here, so the standard precautions. It's just kind of like a little booklet that you can go through, just kind of flip through just to give you some information. So for standard precautions, you want to assume that blood and any body fluids of any patient can be infectious, and that they recommend that PPE or personal protective equipment and other infection control practices are used. Decisions about PPE use is determined by type of clinical interaction with the patient. Okay, PPE for standard precautions. So gloves are used when you're going to come in contact with blood, any body fluids, any contaminated items, or if they have an open wound and there's sensitive skin or like skin in contact that you have to touch. You don't want to touch it with your bare hands. Gowns are used during procedures where you come in contact with any of their clothing, exposed skin, blood, body fluids, any of that. As well, they want you to use masks, goggles, or face shields, whatever pertains to that case. So you use them during patient care activities likely to generate splashes or sprays of blood, body fluid, secretions, etc. That's just to protect anything from going in your nose, in your mouth, in your eyes, anywhere that you could become infected by this spray. So that's my first booklet. I'll just put it back in the case here. I'll go through PPE just because it did talk about that one first in the first one. So for PPE, the CDC provides information on the selection and use of PPE, which is personal protective equipment, in any healthcare setting, and how to safely don and remove PPE. Donning mean that you're putting it on. Okay, so the types of PPE used in healthcare. Gloves protect your hands. Gowns and aprons protect your skin or your clothing from getting anything on them. Your masks and your respirators protect your mouth and nose, and most importantly, respirators protect you from any airborne agents. Goggles protect your eyes, and face shields also protect your eyes, but they also protect your face, nose, and mouth. So factors that are influencing PPE selection. So you want to select your PPE based off of what type of situation you're putting yourself into. So the type of exposure anticipated, so whether you're going to be splash or spray, so if something could splash or spray at you, or versus if they're contaminated and you touch them, you don't want that. As well as the category of precautions, such as, like, for example, if somebody just has a flu or one of those things, sometimes you would wear a mask, but if they have something like tuberculosis. For example, when I did my co-op in the hospital last semester, I did have somebody with tuberculosis, and I did have to get fitted for an N95 mask to be allowed in there. That's just a different level of precaution. And then you also want to be able to test the durability and appropriateness for the task, as well as fit. You want it to fit snug on your face if you're wearing a mask, and you don't want anything to get loose and caught on anything. Continued with the last slide here. Anticipated exposure includes touch, splashes, sprays, or large volumes of blood or body fluids. So anything that could penetrate your clothing, leak through, that sort of thing. And durability, this affects whether a gown or apron is selected and whether it has to be fluid resistant, fluid proof, or neither. So gloves that they have, so the purpose of them is patient care, environmental services, etc. So glove material, it can be anything between vinyl, latex, nitrile. They do have some other ones, just to give people an overall option. Some people are allergic to some types of gloves, or some gloves are better than others for a certain task. So sterile versus non-sterile, that just depends on what kind of person you're working with, whether they're sensitive or very easily to contract other things. Whether you use 1 or 2 pairs, just again extra protection, and whether they're single use or reusable. Okay, so gloves. So most patient cares only require the use of a single pair of non-sterile gloves. That's just what happens most often. And gloves should always fit the user's hands comfortably. They don't want to be too tight or too loose. Always change gloves as needed. Gloves protect you against contracting infectious material. However, once contaminated, gloves become a means for spreading infectious material. You don't want to give it to somebody else. So always wear clean to dirty, referring to clean body sites first and then contaminated sites, so you just don't contaminate the rest. So gowns and aprons, it's just going to go over purpose of use, materials, so natural or man-made, reusable or disposable, and resistance to fluid or not, and clean versus sterile gowns and aprons. So isolation gowns are generally the preferred PPE for clothing, as they fully cover the torso and have long sleeves that fit snug at the wrists. So face protection. Masks protect the nose and mouth and should fully cover your nose and mouth and prevent any fluid penetration, so that you want them to fit flush against your face just in case something does and it can come back down. Goggles protect your eyes and they should fit snug around your eyes. Again, you don't want something splashing up at you and fitting through the holes that you have. And personal glasses are not a substitute for any of these. Respiratory protection. Purpose is they protect from inhalation of infectious aerosols, for example, again, tuberculosis. PPE types for respiratory protection, particulate respirators, half or full face respirators, or powdered air purifying respirators. Okay. The most commonly used respirators in healthcare settings are the N95, N99, and N100 particulate respirators. They filter out particles that are less than 5 microns in diameter. Elements of a respiratory protection program: medical evaluation, fit testing, training, and fit check before use. You always want to make sure that it's going to do what you want it to do. So that's going through that one. I'm going to go through this one next. Again, donning just means to put on. So this one is how to safely don, use, and remove PPE. So key points about it is that you always don or put on before you come in contact with the patient. You always want to use it carefully. You don't want to spread contamination between patients. And And you always want to remove and discard carefully in the proper way that you're supposed to. As well, you always want to immediately perform hand hygiene before and after each patient. Okay, so the sequence, in the order that you want to put things on is this. So you're going to put your gown on first, then your mask or respirators, goggles or face shields, and then finally gloves. And I'm going to go over how you would perform putting those on. So how to put on a gown. So you want to select the appropriate type and size. There are 2 ties, so it's going to tie around your neck and around the waist. And also, if they're too small for you to use, you can tie one. You can have 2, so one facing your front, one facing your back, and just to clarify down there. How to don a mask. So you place it over your nose, mouth, and chin, and there's the metal flexible piece where your nose should be, and you just want to fit that right over your nose, and most of them do have secures for elastics, and you put them over your head. Some of them just have ones behind your ears. Okay, so how to put on a particulate respirator. So you want to select a fit-tested respirator, someone that fits you, and you want to place over your nose, mouth, and chin just like before. Fit the flexible nose piece over your bridge and secure, and then adjust and perform a fit check. So basically a fit check is just inhaling and exhaling to make sure everything's working properly. So how to don eye and face protection. So you want to position the goggles over your eyes and secure to your head using the straps. You want to position a face shield over your face and secure on brow with the headband attached to it. And you always want to make sure you adjust it to fit comfortably on your face and make sure that it fits. So how to put on gloves. You put on gloves last, like said before. You always want to make sure that you select the right size and type. And you just want to, once you put the gloves on, you're going to extend the gloves over your isolation gown. So your isolation gown comes to your wrists, and you just want to make sure you cover over top of that so that everything is completely covered. So how to safely use PPE. So you always want to keep your gloves and hands away from your face. That way you're not touching things with your gloves and then going to touch your face when the gloves are contaminated. And you want to avoid touching or adjusting the PPE once it's on and once you become in the room. So you always want to remove your gloves if they become torn immediately as soon as you know. And you want to limit the surfaces and items that you've touched when you're in there. So the sequences for removing PPE is you want to remove your gloves first, then face shields or goggles depending on what you're wearing, then your gown, and then your mask last. So where you want to remove PPE is at the door before leaving the patient's room, and remove respirator outside room with door closed. And you want to ensure that a hand hygiene facilities are available at the point that you need it, because again, you want to do that right before you do any other activities. So how to remove your gloves. You grasp the outer edge near your wrist and you peel away from the hand and place in the other. So place in the hand with the glove on. And you're going to want to slide your ungloved finger under the glove and peel off from the inside, and creating almost a bag-like for your gloves. And that's the best way to discard them without touching the dirty gloves. So removing goggles and face shields. So you want to grasp the ear or head pieces with ungloved hands and lift away from your face, and then place it in designated disposal or sites for reprocessing. So some of them can be used for one use, or some of them can be repurposed. So removing a gown, you want to unfasten the gown ties with the ungloved hands and slip hands underneath the gown at the neck and shoulders and peel away. When you peel away, you want to fold the gown towards the inside and roll into a bundle. And again, some of them can be discarded by just throwing them away. Others have to be repurposed because they can be used again. So removing a mask, you want to untie the bottom, then the top tie, and then remove from the face and discard. Others just have slips behind the ears, same thing, you would just take that off and remove from the face and discard. For removing a respirator mask, you want to lift the bottom elastic over the head and then lift the top elastic off the head and then pull away from your face and discard. Hand hygiene. So performing hand hygiene immediately after removing PPE is the best way to go so you're not spreading any contagion. You want to wash your hands with soap and water or use an alcohol-based hand rub. Always wash your hands if they are visibly contaminated with something, and ensure hand hygiene facilities are always accessible when you need them. Okay, so that's that one done. I'm just going to put back in the box there. So 10 common medicines. I found this information either online, or I do have many nurses that live next door that I kind of went over with them, and they told me what would be a good thing to put in here. Okay, so the first one is Vicodin, which is hydrocodone or acetaminophen. It's a popular drug for treating acute or chronic pain, and it can reduce breathing, impair thinking, and reduce physical abilities. Side effects here. So lightheadedness, dizziness, nausea, and vomiting are all side effects of this. Gravel, which we all know. So it's a non-prescription drug used to prevent and treat nausea or vomiting. But as your body gets used to the drug, you will need more as you go because you gain a tolerance to the drug. So the side effects here are still in the blue: drowsiness, dizziness, and blurred vision, dry mouth, nervousness, or excitement. So morphine is used to relieve moderate to severe pain. So I just did state here that it's a class of medications known as opioids. And again, I did the injection form here. So it's injected into the muscle every 4 hours. So here the side effects are dizziness, headache, seizure, lightheadedness, mood changes, nausea, vomiting, or hallucinations. Okay, Lasix. So it's a potent diuretic that is used to eliminate water and salt from the body. So it works by blocking the absorption of sodium, chloride, and water from the filtered fluids in the kidney tubules, causing an increase of output of urine. So it's just saying to flip over here just because I didn't have a lot of room. So I put the side effects on the back here. So low blood pressure, dehydration, electrolyte depletion, jaundice, rash, nausea, diarrhea, abdominal pain, and sensitivity to light. So if I move on to the next one, tazocin. It contains the substance piperacillin and tazobactam. It is used to treat a wide range of bacterial infections. It works by attaching to proteins on the surfaces of the bacteria, and by doing that, it infects them and kills them. So the side effects are nausea, vomiting, constipation, indigestion, rash, or vomiting. A lot of these common medicines have a lot of the same side effects, but I just wanted to state them anyways. Same with this. So diluted is used to relieve pain in the form of an oral or liquid tablet. This is used in an opioid tolerant patient. So this is when those opioids that they've been prescribed no longer work, and they still require that around-the-clock relief. So the side effects are cold and clammy skin, convulsions, drowsiness, slow heart rate, trouble breathing. Just wrote flip here. These side effects will go away but the more common effects that they get would be joint pain, nausea, muscle pain or stiffness, difficulty with bowel movement, or trouble moving. Just more common ones on the back there. So ondansetron blocks the actions of chemicals in the body that triggers nausea and vomiting, and prevents vomiting caused by surgery, cancer, chemotherapy, or radiation therapy, which are all known for causing people to puke. So side effects include blurred vision, slow heart rate, anxiety or agitation, shivering, and loss of consciousness. So next one here, metformin. So it's used with a proper diet and exercise program to control high blood pressure. So controlling high blood pressure helps prevent kidney damage, blindness, nerve problems, loss of limbs, and any sexual function problems. So it is a good thing to keep control of. But the side effects are nausea, vomiting, upset stomach, weakness, metallic taste in the mouth, and lactic acidosis. Next one here, so Ansuf is an antibiotic used to treat a wide variety of bacterial infections. This medication is known as cephalosporin. Sorry, I'm horrible at saying that word. It's an antibiotic. It works by stopping the growth of bacteria. So the side effects include swelling, redness, pain, or soreness at the injection site, nausea, vomiting, headache, diarrhea, same ones as a lot of them before, and amoxicillin. So it is a penicillin type antibiotic used for treating several types of bacteria. Both amoxicillin and penicillin are very good at treating bacterial infections, most commonly prescribed for ear infections, if you have tonsillitis, throat infections, any UTIs or urinary tract infections, that sort of thing. But they do have some side effects, and they include diarrhea, heartburn, nausea, itching, pain, vomiting. You have confusion, rash, or allergic reaction. So there's that one. Actually, I might leave that out because I'll go through these next. So I'm just leaving this out to the side here. So I made couldn't get the word out when I was trying to email you. They're not really case studies. They're more of like patient cases that I just thought would be a good idea to help people to understand what's happening. So inside, sorry, I only have so many hands. I created a medical chart, and the second page here is just my response to what their answer should be. So I just made up a name, Jane Doe, vitals, height, weight, age, gender, just the general to give it that look. So I'm gonna go through and just explain it and explain what I want them to do and go through my answer. So the history of the present illness. So the patient is complaining about foul-smelling urine, and she also complains about frequency to void. So frequency to pee, but she can only get out a few drops at a time. And also she experiences a burning with urination. So that's just, that's just what's happening right now. Here I just did some past medical history and allergies, because allergies are an important thing to know. So for the physical exam, I just stated like 4 out of 10 for abdominal pain, 5 out of 10 for pelvic pain, lower back pain, and denies bleeding or any blood with urination, and frequent discharge. So I put here, so the patient is currently suffering from a urinary tract infection or a UTI, and proper treatment must be recommended. So these are the history of the present illness and the physical exam, both. I looked up both, and this is what I came up with. So for a UTI or urinary tract infection. So on the bottom here, I just have determine the medication to treat the patient's infection using the 10 Common Medicines booklet, which is that one. And again, I'll go through my answer. Sorry, I'll flip it so you can see more. So based off of the 10 Common Medicines booklet, the best option was to provide the patient with an antibiotic known as amoxicillin. on the amoxicillin slide, it actually states that it does treat urinary tract infections. So although I feel like it's just a good thing for people to be able to understand realistic examples. So it's also suggested to drink a large amount of water to flush out daily bacteria, and prevention is key. So I just went on to state like different preventions that you can use for a bladder infection instead of using a medicine. So that's the first one. I'll put that away in a minute. I only have one hand. Again, I did 2. So I'll get this one out. So the next one, just did a man to switch it up. Same thing, height, weight sort of thing. So the next thing would be past medical history, amoxicillin and penicillin, which is an allergy that I'm quite familiar with. So the history of present illness. So the patient complains that it's hard to breathe and breaths become more frequent for them, and they have a sweat over their skin even though it's very cool to the touch. And during their physical exam, they had shortness of breath, slow and shallow breathing, an increased breathing rate because of that slow and shallow breathing, and they had a wheezing or grunting noise coming from them when they were breathing. So the diagnosis here is that the patient has respiratory distress, which is actually an illness, and has been treated by pain medication as well as others. So this is also correct information up here for a person that has respiratory distress. And down at the bottom here, the patient has developed side effects to the pain medication prescribed. Determine the drug using the 10 Common Medicines booklet and the following side effects. So using this booklet, I just want them to go through and find out which medication could be causing them this. So they are experiencing nausea and vomiting, hallucinations, and headaches. So based on that opinion, the patient was prescribed with morphine. And if you look through the booklet here, morphine is used to relieve moderate to severe pain and right there, hallucinations, nausea and vomiting, and headache. So it helps patients with respiratory distress to help calm and slow their breathing and to help regulate their breaths. And I just wanted to state here, although it is a very useful drug, many people can earn a tolerance, meaning that the dose is increased as tolerance is gained. So although this is helpful for those people, they can gain a tolerance for it. Okay. And sorry, I'm just trying to make it so that it's clear to see. And for the last thing, I just made a small flashcard game, just to more like a quiz kind of thing, just so that people can appreciate what they've learned from it. So PPE, what is PPE? PPE stands for personal protective equipment. What are the types of PPE used in healthcare? Again, they would flip it over: face shields, gloves, gowns and aprons, masks and respirators and goggles. What antibiotics were gone over in this kit? So I went over 2, and they were Ansif and amoxicillin. Where to remove PPE is at a doorway before leaving the patient's room. What are the standards precautions for wearing PPE? And there's gloves when touching blood, body fluids, secretions, etc. Gowns for when contact with clothing, skin, body fluids is anticipated. Masks and goggles is used when activities generate splashes or sprays of bodily fluids. What are common side effects with each medicine? So, based off of my booklet there, dizziness, headaches, nausea, and vomiting are all common side effects of these top medicines. So what do face shields and goggles prevent from? They protect the mouth, nose, and eyes, and they should always feel snug to the fit. That is super important. And what are the key points about PPE? So the key points about PPE is that you always put them on before contact with patient. You want to use carefully. Please don't spread any contamination between anybody. And remove and discard carefully, and always perform hand hygiene. So how to remove gloves safely, So you want to grasp outside near the edge of the wrist, peel away from one hand and place in the other. Again, slide ungloved finger under the other glove. Peel off from inside, forming a bag-like situation so you can just throw them out. So what is morphine prescribed for? It is prescribed to relieve moderate to severe pain. So just some key topics about stuff that I went over in there. If you need any more information, I'm going to send you all my notes, my bibliography, and anything else that you would need. I can't think of anything off the top of my head. If I went too fast or you can't see anything, just let me know and I can always send you a picture, or I can try and make it more clear for you. I just personally find this a little bit, scary, I guess, because I'm not normally used to videotaping myself doing things. But for sure, if you need anything else for my project or any clarification, just email me and we'll go from there. Okay, thank you. Bye.